mapping on the stereo EEG. But if we can find that in the seizure onset zone, and let's say after the evaluation, part of where the seizures are coming from is in a non-eloquent area where we can remove. In those situations, we would recommend a resection and then an RNS for the part that cannot be. So we kind of, what I try to make sure is that we're not, we do the surgery to kind of get the information and then decide. You don't want to take any options off the table, right? But once you get all that information, then we make the best decision, whether it's resection only, resection plus RNS, or RNS.
We go to Children's Hospital in Philadelphia, that currently won't approve an RNS for someone less than 17 currently.
Okay.
So we need to gather information, find a hospital facility willing to do that if that's what we choose to do, and then present all the information and have them make a decision, which is terribly difficult considering all the factors that go into over the past 5 years. A lot of what we have a lot of distrust in RNS because DNS wasn't presented very well. It's kind of presented one way and then something. This works great for some people, but it didn't work for us, which has kind of been our story. So, is there an unbiased location to find RNS research? Is your opinion that might be one, someone else might be another? It's hard to.
I mean, there is the challenge is there's not enough, right? Each center has a few. Nowadays, the reality is a lot of the device companies, the federal government doesn't independently fund. They they go half in. They want the company to also participate in the and obviously they're interested to know if the device works or not. So it's very difficult to get information that's let's say the company is completely not involved with. But I can say, for example, I'll give you, our hospital, where I'm at, UCLA, very busy pediatric epilepsy program, but we work very closely with our adult epilepsy because we're not a children's only hospital, right? So we actually learn from the experience of the adults because they've been doing this for a lot longer than we have on, from RNS and these devices that we're kind of. So we have our institutional experience, and we can I'd be happy we can connect you with some people that kind of tell you what that institutional experience is, our own, separate from what the company publishes. But your concern is, I've heard this a couple times, where especially when the VNS hasn't worked, and it sounds like